And joining me now this Sunday morning is Dr. Jennifer Russell, Chief Medical Officer of Health for New Brunswick. She's also the co-chair of the council representing all provincial and territorial chief medical health officers in this country. Good morning to you.
Good morning, Rosemary.
I want to start by getting a reaction to the news this weekend that Canada has now surpassed 1 million total cases. As we cross that milestone, what is your biggest worry right now as a doctor and public health officer?
Well, obviously the variants are contributing to the increased number of cases right now, and the fact that I think we're going to see a rapidly increasing number of cases because of the variants, increased transmissibility, et cetera. So I think that's very concerning, and the fact that it's more aggressive. The variants are more aggressive, the UK variant, Brazil variant, and it is affecting younger people in terms of hospitalization and ICU admissions.
Are you concerned about what we have seen in the past after holiday weekends when we do see spikes in cases?
Absolutely. Rosemary, this is really a critical time. And when you think about the three most important things right now, the variants, vaccines, and vigilance. So the 3 V's are the most important thing that's going to get us to the finish line right now in terms of trying to stay ahead of the variants, being very vigilant, and getting everybody vaccinated with 1 dose as quickly as possible, and then obviously with that 2nd dose as quickly as possible.
Well, I do want to ask you some questions about vaccines, because the chief medical health officers across the country decided to act decisively with a unified position in the decision and the recommendation to pause the use of AstraZeneca for people under 55. You call that a precautionary measure because Health Canada is still looking at emerging data. Do you believe that there is enough scientific evidence to justify suspending this for people under 55 as we are faced with all those challenges that you laid out, particularly the variants?
Well, I hear what you're saying, Rosemary, and I do agree that between Health Canada and NACI, the National Advisory Committee on Immunizations, that between those two bodies, we are getting very good advice with respect to how to proceed with our vaccine rollouts as safely as possible. Obviously, speed is the key right now, but obviously we have to couch that with safety. And so as much as we've had to shift and pivot, we will probably continue to shift and pivot as the rollout continues. We know that the number of doses is key in terms of what gets delivered at the national level and then distributed per capita across the provinces and territories.
What do you say then to people who are still very confused about the messaging around AstraZeneca? I'm sure that you, just like me, have people in your circle who are saying, oh, I hope I get this one or that one and not that one. So what do you say to Canadians who are still not sure what they should be thinking about AstraZeneca?
I would say go below the headlines and the sound bites to understand the numbers. The risks right now in every province is higher to get infected with COVID-19 and one of the variants. That risk is higher than any kind of a problem that you could have with any of the vaccines at this point in time. And your risk of dying or having a very serious outcome with COVID-19 and the variants right now is much, much, much higher. So if you delve into those details, it is reassuring at this point in time that it is safer to get the vaccine at this point, any of the vaccines that are offered to prevent this, what's happening with the surge in cases in the variants to affect you personally.
When you hear politicians, I'll give you one example. Ontario Premier Doug Ford, for instance, say that he would wait to receive a vaccine rather than, quote, roll the dice on AstraZeneca. At the same time as your Premier, Blaine Higgs, got his first shot of AstraZeneca publicly. What do you say to politicians around this? Because their messages and their confidence in vaccines are obviously very important from a public health perspective too.
That's a very important point, Rosemary. I think the leadership across this country it's necessary to have a united front. It's necessary to have a unified message for confidence and to allow for that trust by the public in all of the messaging that we're providing on vaccines. So again, at the end of the day, a layperson may not have all the same information that specialists and physicians, et cetera, have. Mm-hmm. But again, there is enough information, enough data that we feel very confident in all of the vaccines as they are right now in terms of what Health Canada and the National Advisory Committee on Immunization is recommending. And again, the stance of all the chief medical officers across this country, again, with that unified message to really increase people's knowledge and understanding about the safety of vaccines at this time and the importance of them in light of the variants.
It was in January that the Chief Medical Officers of Health recommended that the interval between dosing go all the way up to 4 months. I understand that NACI is looking at that delay, and perhaps we might get some news as early as this week about changes there. Do you still believe that that is the right thing to do, to delay the second dose up until 4 months because of issues around supply and other things?
I absolutely do, Rosemary, and the reason is because we know that we have to use a population approach for protecting the population across Canada and in our in individual provinces and territories. And the fastest way to get everybody with a maximum amount of protection, not the most protection, but the maximum that we can with one dose, is to give everybody that first dose. And then when we can get that second dose in safely, then great. When we look at the data of what happens to our immune system when we get that first dose, it reacts pretty well within 2 to 3 weeks. And I think that's the other piece. You know, when you read a headline, you hear a soundbite, you have to delve deeper to hear that, you know what, that effectiveness is really protective. And so if anybody has any doubts, again, dive deeper into the body of that work and you'll hear that information. It's very reassuring.
Do you know what the changes will be this week? I think there were some questions around perhaps not delaying doses for certain age cohorts, older Canadians. Is that what you're expecting potentially?
Well, we'll have to wait and see. I've been on some meetings and discussions last week and part of this week, but I can't really comment on what NACI is going to be saying. I will be participating in some of the media this week on that. So Wednesday, I believe, is when that's going to happen.
Okay, that's great. Let's just end with where you are. I think there's 9 new cases in New Brunswick, which I know to people in other places like where I am in Ontario doesn't sound like a lot. But the Atlantic bubble, there's talk that it might come back. Everyone's still pointing to the Maritimes as very much a success story. What are your concerns right now for where you are? Are things returning to even more normal? Will we get back to the Atlantic bubble?
Well, these things are all dependent on what's happening with our number of cases, but it's not just the pure number of cases. It's the fact that they're mostly the variant right now. So there's a higher proportion of people that need to be hospitalized. There's a higher proportion of people that need ICU admission. So it will be telling in the next week. And obviously after the Easter holiday weekend, again, I think anything can happen at this point, and we're very, very concerned. And we do want citizens to understand the risks right now around these variants. Again, variants, the 3 V's, variants, vigilance, and vaccine. So really, this is a very critical time.
Do you think it's realistic that the bubble could come back within 2 weeks, or is it too soon to say?
I think, again, we'll have to watch and wait. Cabinet, the premiers, our epidemiology teams from all 4 Atlantic provinces have been meeting, as well as the Chief Medical Officers of Health on this topic. And it is an evolving situation. I can only say that it is very, the differences from week to week, from day to day are incredible. So we'll keep watching and waiting. If we can all agree and feel safe and secure about our ability to contain the variants right now, great. But again, time will tell.
Okay. Dr. Jennifer Russell, thank you so much for joining us this Sunday morning. Appreciate it.
Thanks, Rosemary.